today we're going to discuss how to blend our expertise with coaching. The question we often get asked is, am I a health coach and then do I switch hats to become my other profession or expertise? Like, am I a dietitian for one consult and then a health coach for another? Or am I a GP for this consult, but a health coach for another? And what we always say is that it's not about switching hats. It's more about integrating the approach. And well, unless, Sharon, we're in sort of maybe an emergency situation, we're probably not going to coach someone around a broken arm, right?
Yes. An acute approach is very different than a behaviour change approach, which is around, a chronic health condition or something that's lifestyle based.
Yeah, exactly. So, however, the majority of people we work with and that come and learn coaching are working with people that are trying to change a lifestyle related condition, improve their health, reach that optimal version of themselves. So we are integrating coaching with the majority of our consultations.
Yeah, absolutely. So, when we're training these, we're training dietitians or we're training nutritionists or naturopaths or nurses or GPs, and they're always saying, how do I go from my expertise into coaching? And what we know is that if you try to do that, it's not going to work. It ends up really jilted. And in fact, we're always coaching. Coaching is the foundation of our new approach as a health professional that's specializing in behavior change.
Yeah, absolutely. So we're always client-centered. We always have that approach where we are asking for permission. We're on the same page as our clients in terms of not us being the expert and them being sort of down there as the sort of passive patient. So we have this coaching approach where it's a collaborative approach the entire time. Our expertise, though, come into play when a client needs our expertise because there is an information or a skills gap. So
that's right.
Yeah, so Sharon, and this is the interesting thing though, isn't it? It is not about assumptions with what our client might need, and maybe they've booked in with us because we're an exercise physiologist or because we are, a dietitian or whatnot, or they've got a particular condition and they might have been referred in to us because, we've got a specialty in diabetes, for example. So therefore we think, oh, right, okay, this is where I put my expert hat on and I tell them, all about the condition and then how food plays a role. And but it's not really the right approach, right?
Yeah, absolutely. So I think, we've trained for all these years. So let's use the example of a dietitian because we are both dietitians. You've trained for all of these years. I worked for a long time in diabetes, and someone comes in and you think they are here to see me because I am an expert in this area. And so we immediately assume what they need. We already know what we're going to deliver in that consultation. We might even have our own little tick list of what we need to get through, and we will start. So most health professionals are really collaborative. They've got beautiful communication skills, but what we fail to realize is that they're not necessarily there for our full expertise that we think they're there for. And they might, as you said, they might only need a small amount to fill that skills gap or that information gap. So when they're coming in, we're really needing to be using our health coaching skills to filter. It's like a funnel, they come in and we use those great open questions and our reflections and our summaries to work out what's going on till we get down to this point where we've identified what's missing. And we always say health coaching provides them with what they need when they need it. So rather than starting at the beginning and pressing play and talking all about what diabetes is and how you need to change your diet and the importance of glycemic index and then starting to look at their diet and make some changes, that's us assuming they have no knowledge. That's us assuming they've never done any research about diabetes. They've never spoken to anyone about it. And that's often incorrect.
Yeah, absolutely. As you said, it's around, I think what happens with us with expertise sometimes when we've learned coaching and we have the other expertise, we suddenly can maybe hear something that the client says to us during a consult, and we go, oh, yes, this is my expertise. This is where I jump in and educate about that area, or this is where I suggest different meal ideas, or, you know, or whatnot, as opposed to our role really, if we've got that coaching approach, is to say, okay, what is it you know, have been referred to me for, or what did you come to see me about today? What would you actually really love to achieve working with me over, you know, this consult over a period of time? What would you like to achieve for yourself? Like, what's the optimum healthy vision of you? What plays a role in getting you to that place? And then we essentially help people to unpack, as you say, the pieces of the puzzle before we just jump in with something that we hear that sounds like it's for our expertise, you know, it's our expertise, or before we unpack it all and actually work out what's the priority areas. And it may be a few that lie under our expertise. And we're not doing the client any favors if we jump in straight away without helping them to lay it all out and then go, all right, well, there's a few areas there that sounds that it's important for you to work on that will help you get towards where you want to, you know, your optimum version of yourself, what you want to achieve. We've got, say, 20 minutes left in the consult or 30 minutes left in the consult. What feels like the most valuable area for you to work on right now, and where can I help you? Or what would you like to prioritize over this next consult and the next few consults? So we're always checking in. Or if, you know, what's your understanding of your condition that you've just been diagnosed, you know, with, or, you know, when we're asking these checking in questions, we start to work out what the client actually needs, what the gaps are, and then we can actually then provide the right information, expertise, the gaps to meet the client's needs without wasting their time when we press play or we jump in too quickly, which can confuse them and waste time. And suddenly we've got 5 minutes left at consult and they still haven't got their questions answered or what they actually really want.
Yeah, and we really can waste a lot of time being efficient in our own minds. So we can think, right, this person is here. I've got all these things that I need to cover. I've got to, you know, I've got to do an assessment. I've got to do this. I've got to educate them, and I've got to make sure that they leave with an action plan. And so that's that real traditional approach where we're driving the agenda. You're here for diabetes. You're going to have to change these things. This is what you need to know, and this is what you need to do when you leave. And with coaching, we're not taking that lens anymore. We're saying, okay, this person that's come in has got knowledge, they've got skills. I need to work out why they think they're here and exactly what you said, what they want to achieve in this consult. And then out of those things that they've been told sometimes that they have to change by another health professional, helping them to sort through them and choose the one that they want to work on. So, you know, we're dietitians, but sometimes we talk to people about how they're going to move more, because they say, well, out of those three things, like, you know, I think I'm doing okay with my diet. I probably could move more. And, you know, there's not much I can do with stress, but let's start with movement, and then maybe the other things will fall into place.
Yeah. And that's the coaching approach, isn't it? We're not providing advice unless it is that, you know, falls within our expertise and that they've asked for it. Or, you know, we can see a gap and say, look, you know, obviously you've said that you've just been diagnosed with this condition. I'm wondering, would you like me to go through, you know, do provide a little bit more of understanding of how nutrition plays a role in this condition? And they can say yes or no. You know, they can say, oh, well, actually, my sister's got it, my dad has it, and I've done a lot of research. So I know I've just been newly diagnosed, but I have a pretty good understanding. And that's where we get rid of assumptions, you know. Or they can say, you know, that'd be great. Or and we can say, well, do you want us to start from the top, or are there things you already understand? And, you know, again, we are time saving with these types of questions, as opposed to just assuming because we hear something like a new diagnosis or that they've been referred to us. And so as the dietitian or as the exercise physiologist, we have to provide the nutrition advice and the exercise advice, as opposed to really providing value in the consultation and providing something that the client wants and that will really help them to get what they actually want long term. Which is, I think it's a key point, isn't it? That providing value, Sharon.
Yeah. Or we have our perceptions of what's value. You know, I've trained for all these years in nutrition. So if I don't give you a full nutritional assessment and a full nutritional recommendations and give you an action plan, then I haven't provided value to you. Whereas in the scenario we're talking about, someone's come in, they've got a whole family who's had diabetes. They already know, they know what to eat. They know the parameters of what they're supposed to be, you know, the principles of the diet they're supposed to be following. And so gathering that, using that sort of funneling and understanding where they're at, and then saying, great, so you're understanding the diet. So what can I help you with? Is there anything you want explaining? Is there anything that's unclear? Like what do you need from me in our time together? And then they can say, great, I really want to know about inflammation and diabetes, and I've heard all these things about these foods. So in that situation, we might provide a really small amount of information, but helping them to funnel and helping them to come up with a plan, helping them to choose where they want to work first, helping them to work out what's realistic for them, understanding their stage of change. So we're not pushing them to change when they're not quite ready. All of those things, that is what's valuable, because if someone leaves and they've got one action point and it's something they're going to do and they're excited about and inspired to do, that is so much more valuable than the list that I used to send them away with of 30 things to do, of which they probably did none.
Yeah, absolutely. It's totally overwhelming. And it's, as you said, you're not checking in with the stage of change they're at and what they need and what they actually want. You're just assuming and going, here you go, I'll throw everything at you. And hopefully, as you say, like spaghetti at the wall, something will stick. You know, I think what is really interesting about this as well is I often get clients that might be referred into me or they self-refer in. And I think it's really important from the beginning to explain both, you know, the coaching side and my expertise and how they can utilize me as a health professional that's dual qualified. So sometimes clients will be quite surprised at what a coach can do. So I will say, you know, obviously I'm a dietitian. I have expertise around nutrition and food and helping you understand how that can play a role in, you know, achieving, it might be, you know, if they've got a particular condition, like improving your particular condition, reducing your risk factors, or achieving optimal nutrition for your healthy body and mind. And I'm also a health coach as well. So I can support you with mapping out that optimal, healthy vision of yourself, what it can take to get there, and how you can tap into intrinsic motivation to help you sustain that long-term change and overcome any barriers that might throw you off or that have stopped you creating change in the past or currently are. And so when you sort of explain your role and they say, oh, right, okay. And I'll say, so the coaching side means I can coach you around any area of lifestyle that you'd like to create some change in. So that's not limited to nutrition, even though we can apply it to that. That could be sleep, you know, stress, exercise, you know, alcohol reduction, smoking, etc. And they say, oh, that's fantastic. And they suddenly get this idea that, all right, well, I can use your expertise, but I could also, you know, utilize you as a coach in so much more. I think it's so valuable. I think when we also help the client get that understanding of what we offer.
Yeah, that's right. And, you know, we have expertise in our field, you know, nutrition or exercise physiology, etc. And we have expertise in behavior change. So we say we're behavior change experts. So utilizing those two skills, we're supporting the client to sift through their priorities, to sift through their knowledge, and to come up with a plan in conjunction with the client, sort of led by them, co-created. And we're using our expertise to put the scaffolding around them to make sure they're going to be successful.
Yeah, exactly. So the client then understands that they're getting so much more from you, but then they've got this behavior change expert and there's expertise that can be used in a whole variety of ways that can help to map out this ideal version of themselves, but that they can tap into your expertise when needed. And you can explain this as part of your introduction as well, in terms of, I'm sure there's lots of areas that you already understand about your condition or that you might not understand, and that you know, feel free to ask me, you know, what you need, and I'll check in within the consult. So you can do this from the get-go in your introduction, but as you go, asking those questions, checking in the whole time means that you are tailoring the consult as you go, and you're ensuring the client gets what they need as they go. And of course, you're doing it at the end as well and saying, how did you feel the consult went? Do you feel like your needs were met? Are there other areas within, if nutrition is your expertise, within nutrition that you feel like you would like covered, potentially, you know, next consultation or whatnot? And then by having that approach, Sharon, we are using our expertise to the best, you know, of our ability, and we are ensuring the client gets the best of our skill set.
Yeah, absolutely. And it starts, you know, it starts right from the minute they walk in the door, you know, using those open questions. What are they here for? What are they wanting to achieve? You know, I've got results to discuss with you. What do you already know about them? What do you already know about what they mean? Would you like me to discuss what they mean and what they relate to? And then we're talking about education, you know, what do you need? What do you already know? Finally going to the action plan, what could you get started with? Where are you going to fit this in? Let's look at your diary. What reminders do you need? So we use those health coaching skills the whole time, and then we're dotting that expertise through as needed. And as you said, constantly checking in with where they're at. So they come up with a plan that feels achievable, that they feel they've got ownership over, which is such a huge thing in health. They've got buy-in. They're even excited about it. So when we integrate that health coaching approach right from the beginning, and then we just use our expertise with permission as needed, we create a much more empowered client, and we come up with an action plan that is probably going to happen, unlike a lot of the action plans that we might be sending our clients home with at the moment.
Yeah, absolutely. And that client is much more likely to say, you know what, they were a fantastic health professional who listened to me. They met my needs. They didn't bombard me with too much information. They actually really bridged the gaps in the informations and the skills that I needed. And I feel, you know, a lot clearer with where I'm headed, with the ultimate destination and the journey that's going to get me there to this optimal, healthier version of myself.
Yeah.